I'm gonna tell you a story, okay? And you have to promise not to laugh. So, a few days back in my clinic, I walk into the room and there's a pleasant lady around 30 years of age. And I say, "Hi, how are you doing today?" And she says, "I'm okay, doctor." And I was like, "Oh my God, your voice sounds terrible. Let me see what I can do for you." And the lady just looks at me. So I said, "How long is this going on?" She was like, "What?" And I was like, this. She's like, "No, I'm here for my ear. My voice is totally fine." And so I stood for 3 seconds figuring out what to say after that. And then finally I was like, yeah, I'm sorry, someone gave me the wrong information. I thought there was a different patient. So that was a big lesson learned for me. And why I'm telling you this story is that today we're talking about hoarseness of voice or dysphonia. So the main reason I'm telling you this is because remember, hoarseness for you and hoarseness for me may be two totally different things. I may love my croaky sort of Adele voice, and to you it may seem like a terrible voice. So hoarseness is very, very subjective. So today we're going to break down what is hoarseness medically, what are the top 5 things that cause hoarseness, and what are the treatment options available, what you can do before you go to the doctor, and when you come into clinic, what are the things that we will usually do. So let's start right now. Let me first explain how the voice works. These two white structures that you see are called the vocal cords. You can imagine them like the strings of a guitar. So when you try to speak, your body kind of tightly stretches out these strings, and then you push air through these strings. This causes these strings to vibrate, and that creates what we know as voice. When we look at hoarseness, hoarseness is defined by us as either difference in the amplitude or the frequencies. That means that instead of the voice being harmonic tone, we're getting multiple other non-harmonic intertones. This is a little bit complex, so I'll explain. So for example, if you're listening to music, you may not know what chords are, but you can still understand whether someone is playing well or playing poorly. That means that if someone is playing a major chord, which means the intervals of the sounds are all in harmonics, then the sound is pleasant to your ear. Whereas if these harmonics are not in correct frequent intervals, then you get something called as discordance, which we call hoarseness. When we look at hoarseness, the first thing that we talk to people about is asking them to say some specific things. So usually these hoarsenesses are divided into 2 things. You may be having a sore throat and you're hoarse for a couple of days, or you may be hoarse for a long time, or you may have been doing quite well, you speak normally, after some time you get hoarse. So there are multiple different types of hoarseness that we deal with. So let's go ahead and break down the top 5 causes of hoarseness one after the other, and I'll tell you what are the things we have to do for each of them. The most frequent cause of hoarseness is a young person who has traveled and has come back from a trip and their voice is completely gone. They speak to me like, "I cannot speak, doctor, my voice is gone." And we take a look with the endoscope into the throat, and we usually find an extremely inflamed, swollen vocal cords. The entire voice box is highly red, maybe some white color pus may be seen. This is called an acute laryngitis, and this is very simple. This is basically you've had a cold and cough, most commonly either a sinus infection or a throat infection, and the pus from the sinus or the throat keeps dripping into the back of your voice box, which has eventually triggered the same infection in the voice box. Now, it is very important for us to understand that voice box infections being completely isolated from everything else is very, very rare. If someone comes in, they have not had a cold, they have not had a throat infection, they have not had any of these things, and when I scope, I don't see any pus, these are usually viral laryngitis. Viral laryngitis do not require antibiotics, whereas a bacterial laryngitis will usually be accompanied by cold and cough a few days back, some throat pain, etc., some cough, and then breaking into laryngitis. So looking at the larynx is very important when someone comes in with laryngitis. The most frequent problem that we find is that someone has gone to the doctor and doctor has just given them antibiotics without knowing if it is at all necessary or not. So we look at the throat with an endoscope. It's a very simple pain-free procedure. Some doctors prefer to do it through the nose, some doctors prefer to do it through the mouth. Either ways, it's a pain-free procedure. It takes about 2-3 minutes. It gives us the information. Based on that, we start treatment. Now, if you have a viral laryngitis, that means you don't have a cough, cold, your voice is down. You don't need even to see the doctor unless it lasts more than 48 hours. What you can do is take some warm teas, do a little bit of steam inhalation, at max take a little bit of anti-allergics, and you just basically got to ride it out. So if it goes more than 48 hours, you need to see the doctor. You may have some fever during these 48 hours, which is again normal. There's nothing to be nervous about. If you get a small fever, get a paracetamol. If it lasts more than 2 days, see the doctor. If you have a bacterial laryngitis, however, it's a completely different thing. Now, if you're starting to get throat pain, you feel pain when you're trying to speak, that is something where you do not want to delay, because because remember, these infections can cause abscesses. That means pus collections. Pus collections in this area are very, very dangerous, because if you get pus collections or inflammations of the cap, which is called supraglottitis or epiglottitis, these can actually start causing difficulty in people to breathe, and these can become life-threatening. So if you feel that you're having any discomfort in breathing, your chest is feeling tight, you feel like I have to work a little bit harder to get oxygen in, those are the cases where you should not delay and see the doctor. So number one cause would be laryngitis or inflammation of the larynx. Number two cause would be acid reflux or GERD. Now, this usually comes up to us as you've been to a party, you've been on a trip, you've drank like a fish, you've come back, now your throat is completely screwed. Or, which very frequently something I see, you've had a wild night with your friends, you've been smoking up on different kinds of stuff, and you come in and you try to tell me that, oh no doc, this is sudden, and I look at this voice box and it becomes very evident to the doctor that, this is not an infection, this is a smoke-related injury, because we can see those small ulcers, small redness that causes, and usually we ask the patient in a very non-judgmental way that have you been smoking up anything, and it's completely okay. I mean, as doctors, we are not here to judge, we're just here to help you guys. So whatever is it, if that is the case, then what we usually do is we do a very mild anti-inflammatory, very mild antibiotics, some gargles, and just ride you through the next 3, 4, 5 days till you get back to normal. You could also try the same thing, but one of the things that happens is because of these ulcers, these patients usually will come to us also with difficulty in swallowing food. That is the reason why they need some help. We sometimes also give them some local anesthetic syrups so they're able to eat, and we tell them to take rest for a couple of days. By 3 or 4 days, most of them are back to normal. That would be the second most common cause, reflux or inhalational injury because of smoking up. Number 3 would be allergies. This is where you've had a cold or cough, and a few days later, you've started getting a little bit of sore throat. Here, there is no pus. Here, there is no inflammation. But here, when I'm looking into the throat, I see just some swelling in the back of the throat. And these are the people who tell me that, doc, I keep having this sort of weird cough. I keep having this sort of sensation where after I speak for a little bit, my voice seems like it's choking up, and I have to keep putting in more effort to speak. And this is something that is called postlaryngeal edema. So what happens here is that the vocal cords are like two strings. Now, when you speak, your body actually brings these two together. The two threads will come together, and that's how you speak. Now, behind that, where they come together, if there's swelling, then every time these cords come together, they have to push against this balloon or this swelling, and that's how they come together. So it has to work much harder than in a normal situation, which is why after speaking for a little bit, the vocal cords get tired. It's basically like if I tell you to put your hands together like this and clap, you'll be able to do it for a much longer time than if I put a small balloon here and I just tell you to keep squeezing it, because you're working against some resistance. So this case, our main treatment involves a little bit of inhalational steroids, maybe some nasal sprays, a little bit of anti-allergy medicines, and primarily voice rest. So this usually by about 1 week, you're pretty much back to normal. Now we come to number 5, and this is the most common one for which we may need a small procedure, and this is called a vocal nodule. This is where a patient who usually is someone who needs to speak a lot for their work, maybe a doctor, maybe a teacher, will come and tell me, the doc, for last 3-4 weeks or a month or so, my voice is very hoarse, it's very gravelly, this is not my normal voice. And when we look inside, we will see these two swellings which are rubbing against each other. These are called vocal nodules, and they are basically nothing but scar tissue inside the vocal cord. So what happens is that if you have a swelling or an inflammation in the larynx and you try to push through and you try to keep speaking through it and not give rest, what happens is you are taking the swollen cords and you're rubbing them against each other. When you rub these swollen cords against each other really hard, your body reacts by forming scar tissues. These scar tissues then become like small globules. So when next time the body is trying to come together, these guys come in contact first. So they again rub against each other, they become larger. Again rub against each other, become larger. And this is a vicious cycle that happens. The treatment for vocal nodules is very simple. If you come to me in an early stage, the best treatment is voice rest. So we tell you to take complete voice rest for at least a week. Along with that, we give some powerful medicines to reduce the swelling. If it goes down, and in acute cases it most usually will, you don't need any further treatment. But if this has been going on for more than 3 months, the chances of it going down is not very, very high. The people who it doesn't go down, we will usually use a small laser, as you can see here, and we will shape this down. This is absolutely critical to understand that that these procedures should never ever be performed by doctors without access to laser. The reason is because the laser allows you to be very specific to the nodule tissue and it prevents any damage or heat trauma to the surrounding part. Whereas if I cut those places, I'm also traumatizing the surrounding vocal cord, and my job in this is to do minimal trauma to the rest of the normal vocal cord, because any trauma, any swelling, any inflammation will lead to these cords reforming. So that is why we use a type of laser and we just gently, very precisely shave down those areas. After we have shaved them down, we still have to do the 1 week voice rest, because remember, I'm just shaving the extra scar down. I do need you to heal. Once you have healed after a week and this has gone down, that is when we talk about doing speech therapy, so that you learn, you teach your body how to speak in a proper fashion so that these areas do not keep getting rubbed and the scar doesn't reform. There are multiple other things that can happen because of the same logic, where you've had an infection, you're trying to speak and you've either torn a vessel or you have caused a small swelling or something like that. These are called vocal cord polyps, which could be hemorrhagic types. It can have vocal cord cysts, many things. Pretty much for all of them, the treatment follows the same guideline. If it is early, we try to do the voice rest, the medications. If it is more than 3 months, then usually they don't work. Then we go ahead and remove it off with a laser. The importance of the laser is that it vastly improves our quality of result because it reduces bleeding completely. Second is that it doesn't cause any trauma to the surrounding vocal cord, so it reduces the post-operative swelling to a massive amount. If you see that you are having these kind of issues, the first thing we would suggest is, if it's very recent, like since last night or 2 days back, don't panic. Just give it a couple of days. Drink lots of soup, lots of green teas. Give your voice rest. Take a couple of days off work. The worst thing you can do to yourself is you have hoarseness and you still take your office calls. You still go for your meetings. Don't do that. 2 days off can save you 1 month of hassle. If by doing this it is okay, then you don't need to see a doctor. But if you see that you're getting pain in the throat, or you're having difficulty in breathing, or if you're having difficulty in swallowing your saliva, then yes, see the doctor. That is very important. If there's anything else, please feel free to reach out to me. This would be a basic idea about hoarseness. Whenever you go to the doctor for hoarseness, please insist on the doctor checking your throat with a scope, because without checking, it's very difficult for doctors to understand what exactly is going on, and only by knowing you can be treated. Otherwise, at the best, it's a guesswork from any of us, and that's not a great way to treat these kind of hoarsenesses. So this brings me to the end of the topic. If you have any questions, feel free to reach out to us. If you're in Bangalore and suffering from this, you're welcome to step in. We're always here to help you guys. Other than that, have a good day. Take care. This is Dr. Bhattacharya. Namaskar. I'll see you with another video.